Ouais, c'était bon.
Bonjour à tous, bienvenue à cette...
Good afternoon and welcome to this press conference to provide an update on COVID-19 in Quebec. The Premier is accompanied by a Health Minister and the National Health Director. Mr. Legault, the floor is yours.
Bonjour, bonjour tout le monde.
Hello, everybody. Listen, when we look at the situation throughout the world, we can see that it's improving in Europe. However, it continues to increase in the U.S. But we can see that Quebec, for the second wave, is doing much better than the U.S. and most of countries in Europe. When we look, amongst others, at the number of deaths per million inhabitants, we are doing much better during the second wave. That does not mean that there are no challenges. We still have big challenges ahead. Amongst other regions in the Saguenay-Lac-Saint-Jean, I want to talk about the Saguenay-Lac-Saint-Jean. In the Saguenay-Lac-Saint-Jean, we're continuing, well, that is a place per million inhabitants or per 100,000 inhabitants where there are the most active cases, where there are the most cases overall. So we truly have to hit hard in the Saguenay-Lac-Saint-Jean. I know the people from the region well. They are proud people. And there's not, 1,000 ways to go about things. We have to reduce the number of contacts in homes, fewer visits amongst friends. And we have managed to do so in the national capital over the past few weeks. We reduced the number of contacts and we reduced the number of cases. So it's important to do the same thing in the Saguenay-Lac-Saint-Jean. I invite all citizens of the region to deploy additional efforts over the next few days and weeks. I know that you're able to do great things. So that's a special call out for the citizens of Saguenay-Lac-Saint-Jean. But otherwise, when we look at the situation in Quebec, there's some good news. We can see that the number of new cases is stabilized. We have to be careful when we look at the number of cases. Like now, today we've got Sunday's cases, so there are fewer tests on the weekend, but it's stabilized, 1,200, 1,300 cases per day. So we seem to have reached a new plateau, and that is encouraging. There is no exponential increase. The situation remains under control in the hospitals. So we are below the 600 cases in hospital. It's under control as well in the CHSLDs. Even if we have some cases, it's important to say this, there are way fewer cases, and in the spring, it's night and day. Our schools, the increases, we're talking about 30 classrooms that were added today. So that, too, is stabilizing. And the situation, we can say, is stabilizing in workplaces as well. And we have to remember that we've got 95% of our workplaces are functional right now. So we seem to have found a certain balance. And that means that the measures that we've put in place are working. The other encouraging news is as it comes to vaccines. After Pfizer, now Moderna is saying that there could be a vaccine ready in 2021. Obviously, there are no guarantees. But when we talk to experts, we can think that maybe by next summer, we could go back to a life that is just about normal. So that, too, is very encouraging. So we are making our way through the second wave, and we can see the light at the end of the tunnel. We seem to finally be seeing, or the end is in sight at some point in 2021. However, our main obsession and our major topic of discussion right now is what will we be able to do for the holiday season? I want to tell you that the discussions are ongoing with public health. And I'm repeating myself, there will be no big parties with 25 or 50 people. We're trying to see what is the number of people that will be able to gather in homes without starting up with a new wave. And we will try to tell you that in the next few days. I understand that there's a lot of Quebecers who are sending us signals, who are saying, well, listen, I have to plan for the holiday season. I have to get ready. How many people will I be inviting? Is it Christmas, just Christmas, or Christmas and New Year's Day? So there's a lot of questions up in the air, and I understand that people, the faster they know, well, the quicker they'll be able to plan. Same thing for the schools. We would like to be able, in the next few days, to tell you exactly what will happen with the schools. To be perfectly transparent, what we are looking at is perhaps extending the winter break after Christmas and New Year's. Why? Well, so that there can be a type of quarantine for children before they go back to school, following these family gatherings that will occur during the holiday season. So we want to have a bit of a quarantine before going back to school with other children. So we've got a mission that is collective for the next few weeks. If we want to give ourselves a chance to be able to see as many family members as possible during the holiday season, well, we have to make some efforts before Christmas. So all together, we must work together. We must make some efforts before Christmas. As we inch towards mid-December with a good control of the situation, a lower level of cases, lower number of hospitalizations, well, the more we'll be able to open up a little bit during the holiday season. So I'll conclude by telling you that I know that Quebecers are fed up. Imagine, I am fed up as well. I'm very fed up. I would like to talk about something else, and I would like to work on something else. But there is hope. we are winning the battle of the second wave. We have reached a certain balance. I am convinced that we will win this fight, but in order to win it, we have to fight. And now we have to deploy efforts until Christmas so that we can be able to have a nice holiday season. So I'm asking for the collaboration of all Quebecers.
Good afternoon, everyone. We've been able to fight the second wave so far. Except for Saguenay-Lac-Saint-Jean, the situation is stable. We see the end is coming with the vaccine, but until then, we must continue to fight the virus. Now is not the time to give up. We must continue all our efforts to win the battle. The next step is Christmas. We're preparing a holiday plan with public health authorities. We want an adapted and healthy Christmas with our family. We'll announce our plan soon to allow everyone to prepare. But we'll have to be in good position in December. So we have a collective mission in the coming weeks. We must contain the wave together to have a Christmas time with our family. We must apply public health rules strictly, and I'm counting on you all, so thank you.
Donc, on va débuter la période de...
We will start the question period. We'll take one question and one follow-up question per reporter.
Bonjour à vous trois.
Hello. You talked about schools. There's a lot of parents who are listening to you every day when you have these press conferences, a lot of worries. People are saying, well, we have to get organized now because things are coming quickly, and you'll announce this over the next few days probably. You've given some hints. You say that what we're looking at is extending the Christmas holiday. So does that mean that it'll be more after Christmas? It'll be additional weeks off after Christmas? And can we think that teachers will have to provide classes 100% online? Or will it be an extension of vacation time or days off? During these weeks, if ever we extend the winter break, there would be no classes given during these additional weeks. The question that we're wondering about is when we talk about before Christmas, well, if there, and this is not the case here, but if there was a significant increase, there would have been an urgency to act right away, and that does not seem to be the case now. So now it will depend on perhaps, perhaps we'll put in place a type of quarantine for after the family gatherings, before the children go back to school. So right now we're looking at adding some time after the normal holidays. And these weeks, you've talked about discussions with the unions. Perhaps we could add some time at the end of June, the beginning of July. The unions quickly said there is no way. So the unions, the teachers' unions, are they too strong, and have you abandoned the idea of catching up at the end of the school year? Or do you still believe that students who are lagging behind will have to do those, make up for those days? Well, usually at Christmas, we have 2 weeks of holidays. Now we're talking about 3 or 4 weeks. It's not dramatic. It's not a significant increase in the number of days or classroom days that will be missed. But obviously, we're taking into account the reaction of the FAE, who said there's no way we will not prolong the school year at the end of June. So we are taking that into account. We also take into account the fact that some parents will go back to work, and the daycares and the schools should be open in order to help these parents. So we're taking that into account as well. So that's what we're weighing. Do we add a 3rd week or a 4th week? Nothing has been decided, but we should make the decision over the next few days. Question? Significant increase of hospitalizations, 47 new hospitalizations. Are we at a point of rupture right now, at a tipping point? Are we going towards transfers of patients from one region and one city to the next? I'll let Christian answer, but I want to tell you, I said this last week, when we saw the increase in cases over the past few weeks, without an increase in hospitalizations, we felt that it was coming. So that comes from the increase in cases of the previous weeks. So now it's important to look at where, in what region are these hospitalizations. And I know that Christian looks at this very closely. I would tell you that we've got around 25% of today's numbers. I looked at the details this morning, and they come from transfers from a CHSLD, where we thought that it would be better to hospitalize these people to better serve them. So there's part of it is transfer. It's not new cases, but these are cases that are now hospitalized. The good news is that they are spread throughout Quebec. There's a significant portion in the Saguenay-Lac-Saint-Jean, given the increase in cases. I often say that one day does not a trend make, but so let's be careful. But what the Premier just said, the 1,200, 1,300 cases that we've had every day at some point translate into hospitalization. So obviously we're keeping an eye on that. But I would tell you that it's spread out, but there's a good portion in the Saguenay-Lac-Saint-Jean. Martin Prudel, your objective, is it to let him go? Well, listen, I didn't get involved in that file since the beginning. And we let people who handle the administrative part handle this file. And given that it's before the courts, you'll understand that I'm not going to comment. But I did not get involved in the file since the beginning, and I don't have the intention of getting involved either. Question? Mr. Legault, I'd like to know, as to what will be decided for the holiday season, could it be personalized solutions depending on the regional alerts? Perhaps it won't be the same restrictions from one region to the next, or for the holiday season, to the contrary, will you have a uniform solution for the entire territory? I'm going to try to keep it simple. I like to keep things simple. So that means it's going to be for all of Quebec. For example, you were talking about the Saguenay-Lac-Saint-Jean earlier, which is more worrisome today. Regardless of this type of regional detail, when you adopt the position that you will announce soon, it will apply to all of Quebec, from what I understand? Yes, we want to keep it as simple as possible. Everybody agrees on this. Yes. In the calculation that you're making right now, as it pertains to this decision, and perhaps it's more a question for Dr. Arruda, how can we establish what is our wiggle room in the capacity for the healthcare system to support an increase in cases that could come from an increase in contacts? How can we evaluate this? Well, it's an analysis. It's a complex analysis that takes into consideration several factors and also the reaction of the population, their behaviors, right? Because we can ask people to do something, but if they don't, then it's going to have impacts. That's why we look at the epidemiology. How many cases do we have? We've stayed at a certain plateau, and we'll say with the efforts that we're continuing to deploy, if we'll see a decrease, which will be a good indicator. The number of hospitalizations, of course, the number of outbreaks, can we control them or not, the capacity to contact trace, all of that. These are factors that we look at. Then we look at where were the environments where there was the most transmission, what were these environments. So we have to be able to control these environments. So we have to we look at these analyses, but there's no perfect recipe, right? There is no textbook that will, from the WHO, or even when we compare France and Quebec, when we say that we close restaurants in France, they close at 9, it's not the same thing as here. And between what we're asking for and what's happening in the field, there are two different realities. So I would say that it's a mix of science and forecasts on the basis of the analysis that experts in public health do, and then we ask the government to do different scenarios. If we open something, well, some risks increase, and what we're aiming for as well. We want to aim for, well, the main objective is to have a family Christmas, a healthy Christmas, that it will be adapted. We know that we can't have parties like we used to. So that's the analysis. It's a long answer. You'll tell me that I should have said less, but that's what I wanted to express. Christian wants to add something. Well, I don't want to take too long, but two things. Remember, every Friday, we have a study from the INS that's published, and the INS always looks 4 weeks ahead to see the forecast. When we started seeing 1,200, 1,300 cases per day, that's what worried us with the hospitalizations, because we are losing the wiggle room that we had had for several weeks. When the INS told us at 1,000 cases, we were okay. We could see that it was stable. We didn't see a deterioration. So that's the only factor that I would add. And that is why today, even if there are other factors, today with the day at 1,000, if we're able to have that for several days, I would tell you that we would regain that latitude, the wiggle room with which we were more comfortable. So it's practical, you can see it, and I'm curious to see what numbers will be announced by the INS on Friday. But this is something that's very important that we follow closely with public health and with our partners. Question? Mr. Legault, you mentioned vaccines, a new vaccine from Moderna, which has an efficacy, great efficacy, and it's good news. Now, these two vaccines that work about the same way, well, the warehousing of these vaccines is a little bit different. For public health and for the Ministry of Health, is there a vaccine that is preferred when it comes to its distribution, its efficacy? Can you already tell us that today? Well, I'm not a specialist in this, but from what I understand, the Moderna vaccine does not require to be stored at -80, but at -20. So perhaps that's easier. But I'm not a specialist, but we're getting ready for all possibilities. As soon as a vaccine is received, I want to distribute it quickly in all regions of Quebec with an order of priority that will be chosen by the government of Quebec. But to know more about the advantages and disadvantages of each vaccine, well, listen, these are two RM vaccines that are surprising us. Even Dr. Fauci said that. He said he was surprised that there was 95% efficacy because there are not a lot of vaccines that have that level of efficacy, so we're happy. But I think in the current context, in a pandemic, and with the rarity of the vaccines, you know, being picky between one vaccine and another when the efficacy is pretty much similar, well, we can't afford that. At -20, it's easier than at -70 or -80, but we're already preparing to take either vaccine. We don't want to refuse any doses of vaccines that could help us save some people in the population. I also want to tell people that it's still the time to get a flu shot because we want to protect people. And some things, some people were saying that there was a lot of vaccines that was problematic, and I can tell you that the vaccines that are here in Quebec are safe, and our experts are looking at the entire situation. So I invite the population to get the flu shot, and once we've got the vaccine for COVID-19, we'll move forward. Quickly, Mr. Legault, the owner of Garda World is asking you to intervene in his attempts to buy G4S, which is a security conglomerate. What do you answer? I heard the interview with Patrice Roy, who asked him, what are you asking for? And he didn't really have an answer. Perhaps to summarize the situation, we have the Caisse de Dépôt is investing in an American company called Allied, and we've got this business who wants to buy a British company, G4S. And by happenstance, there's a Quebec company called Garda who wants to buy the same company in the UK. I don't think that the Caisse will add financing with Allied. However, they have proposed $1 billion financing for Garda, the Quebec company, to help them with this acquisition. Now, it's not quite clear what Mr. Chrétien is asking for, but I'm not sure what he wants. I don't think the Caisse has the power and the legitimacy to tell Allied, don't make an offer on the British company. You know, that's the thing. It's not very clear what Mr. Chrétien is asking for. You will let things unfold? Well, listen, apart from helping Garda to finance a possible acquisition, that another, you know, and another company wants to make the same acquisition, well, that's not really under my control, right? question. Hello. Mr. Legault, you talked about measures at work to a certain balance that we've reached, but like many Quebecers today, I'm a little bit disappointed. I expected you to announce Christmas today, a little bit like Mrs. Guilbeault announced it towards Christmas. Well, my question may be strange, but when will you announce the sanitary measures for the holidays? Because the only question that's concerning Quebecers right now is, will we see Grandma during the holidays? Exactly. That is why. We're the 17th of November. Christmas this year is on the 25th of December. And over the next few days, so a month in advance, I want to give people who need to prepare their tortillas and their turkey and all that, I would like them to know how many people they can invite. So over the next few days, we will make Quebecers aware of this. A second question for Mr. Arruda on vaccines. Mr. Arruda, concerning the vaccination strategy that will be established in the next few weeks, we'd like to know what will be the order of priority for the vaccines. Will it be public health? Will it be public health who will prioritize? Or people who are vaccinated, could they be exempt from wearing the mask or other sanitary measures? And finally, will vaccines be mandatory? That's a question that Quebecers want an answer to. 3 elements. So the priorities are established, scientifically speaking, with advisory committees. There's one in Canada, there's one in Quebec. And we will take the recommendations, combined recommendations of both. Usually we vaccinate people who have a good immune reaction but who can also be protected. So the list is not yet drawn up because the vaccines are not here yet. We really have to have these elements first. So that's one of the things. And then afterwards we'll go by priority according to the number of doses available. Now for what was the other question? If we can stop wearing a mask? Well, yes, after being vaccinated. Well, listen, you have to understand that the vaccine is never 100% effective. We're talking about 95%. So the virus will circulate quite a bit, and the scenarios that are proposed is we will not tell people you've been vaccinated, you don't have to wear a mask, and you don't have to be careful, because people could still transmit the illness. And I think it would be difficult to control. Why is he wearing a mask and why is the other one not wearing a mask? Then the obligation. We have a law in Quebec that where we can have mandatory vaccines in exceptional situations where people don't collaborate. I want to tell you that we've never used this law. It is not at all in the cards for us, but life being what it is, so that you don't come back to me later, well, the probability is very, very, very low that we will invoke this law, but if it's necessary, we've got the means to invoke it, as we can do when there's a very significant threat to health. But that's really not how the path that we're heading down. Question? This weekend, Dr. Kellen Wash, who you know well, mentioned that even with vaccines, we had to expect in Quebec that we would maintain the sanitary measures for 12 to 18 months. Do you have the same reading of the situation? Yes, actually. We have to understand that when we start vaccinating people, we will not vaccinate all the population. First of all, we'll have to see how the virus will react to the quantity of people vaccinated. So that means that a virus circulates, if it, as we saw with influenza. So we can't say, well, now we're getting rid of all the hygiene measures, because the virus will continue for a while until we've got maximal coverage. And the other element that we have to understand as well, there could be a reintroduction of the virus in Quebec. So I don't want to be a futurist. Great if things go well, but to think that the day that we've got a vaccine that we'll come back to pre-pandemic life over the short term, I don't think that's right. She talked about the 12 to 18 months. Does that seem realistic to you? It could be that. It could be a little bit shorter as well. But I'm not going to debate this question. What I would, it could be between 12 and 18 months. It could be 9 months. It'll depend on the quantity of vaccines that we will have, the reaction to the vaccine. But if a lot of people don't want to be vaccinated, well, that increases the risk and it extends the duration of the sanitary measures. Now, for the holidays, you talked about a type of quarantine for students. Is this something that you would consider for businesses as well, to tell businesses, keep your employees in teleworking for a week or two after the holidays, just to make sure that there's less transmission? If you'll allow me, the scenarios are not finished yet. The Premier gave you some details, but the discussions haven't concluded yet. So I don't want to say things that aren't, I don't want to, there are some things that we're talking about. There's different combinations, teleworking, no teleworking. Obviously, we're going to promote teleworking, but we are not necessarily shutting down businesses that are currently open. But I don't want to go into too much detail because a bunch of other questions will follow. And even if the Premier makes a decision, that's clear, but we haven't finished our discussions with him and his team. Well, we're not looking at closing businesses more than they currently are for a longer period of time. Question? A question for Dr. Arruda. I'm coming back to the vaccine because people are thinking about this quite a bit. So you've got a plan that's not quite implemented. Can we know what would be the priority? And are we talking about massive vaccination? All of a sudden we have open up centers and everybody goes to these centers. How would it be rolled out and when? Your questions are a good question. And I'd like to know when we'll get the vaccine and how many doses we'll get. Well, first of all, we're going to vaccinate the people who can benefit from this the most. Healthcare workers in all vaccination campaigns, this is a group that is prioritized. And then afterwards, we will vaccinate people who can die from the illness, potentially the elderly. We know that the vaccine, the Moderna vaccine, even if it's got efficacy of 95%. It's also demonstrated that decreases complications. So you can have the illness, but you won't necessarily get the complications. So that's very interesting information. What we'll do is, depending on the quantity of vaccines that we'll have, well, first of all, we'll vaccinate the most vulnerable people. And we won't necessarily do things so as to expose people while they're waiting, and having big gatherings for vaccinations. We'll go towards a massive approach, but on appointment. But these are scenarios that we're looking at, and it'll depend when we'll vaccinate. Vaccinating in the summer is not like vaccinating in the winter. So we're looking at all of this in terms of logistics. Why? What's the difference between winter and summer? Well, in the summer, you can have people outside. You can't make people wait in line outside in the dead of winter at -30 in January or February. So in terms of the risk of transmission in enclosed spaces, there's a greater risk of transmission if it's done indoors versus outdoors in a big parking lot where people can make an appointment and keep the 2-meter distance. Mr. Legault, there are some students, Indian students, who have privileges in Quebec right now. They're studying in English. Do you have the intention of intervening or of shedding light on this situation, which is a little bit uncomfortable for others? Well, yes, I've asked that we shed light on this. From what I understand, there are some organizations that charge significant amounts of money to people from India who want to come to Quebec. They go through a private college. We don't know in what sector they're studying. And because of our programs, well, they are accepted as immigrants quickly, and then afterwards they can even change provinces. So it's not exactly the principle and the idea behind the programs that we have for foreign students. The idea is to say those who come study at the college or in university, these are immigrants that meet our labor needs. But I've asked that we dig deeper because we're talking about an increase, an exponential increase in the number of Indian students who go through private colleges. So this is something that doesn't seem right. Question? We're getting closer to the end of the second 28-day period. Are we going to add a third 28-day period to this? I was saying today that the measures that are in place seem to be working. Usually when something works, we don't change it. My priority, our priority, is to concentrate on the holiday season. And if we are able to keep the same restrictions in place between the 23rd of November and the holidays, that will help us to have a nicer holiday season. Nothing has been decided yet, and in the next few days, we should be able to tell you if there will be some tweaks. On the 23rd of November, I'm thinking about young people. Can we help them to have more activities? These are things that we are looking at. But there shouldn't be major changes on the 23rd of November, even for restaurant owners? Yes. The quarantine after Christmas, why? Whereas a risk for grandparents is before. As I said, the discussions are not done yet, but during the holidays there will be gatherings. So we will increase the probability of transmission within that period of time. If people develop the illness while they're decreasing their activities, it'll be easier to do the contact tracing with these people and also easier to isolate them and to isolate their contacts. So it's clear that after, let's say you have a party, you get the illness. Well, if we give you some time where you're not infecting colleagues at work, et cetera, that's why after a big period of exposure, for example, it's like when you go to other countries and you think that perhaps you got the illness, what do we tell you when you come back? We say, stay home. So it's the same idea. Question? Hello. We saw that there are some age groups, young from 10 to 24, where the cases are increasing. We have the impression that the message is not getting through with this portion of the population. So what will you do to have the restrictions respected? Will you ask Sarah-Jeanne Labroche or Pierre Levin to record some messages to try to reach them? Well, I think there's already some publicity that's being done by young people. Do we have to do more? That's a good question. It's part of what we're looking at currently. If you'll allow me, the 20 to 29-year-olds, where there were a lot of cases this summer, is decreasing now. And now it's a 10 to 19 or the 0 to 19 years of age is increasing because of back to school. So I want to mention that this group of people, and it even decreased between the 1st of November and the 1st of October and November, we can see that it's decreasing a little bit. Unfortunately, the cases that we're seeing is with the elderly. So it fluctuates over time. But I think that your idea of having targeted communications through media that reaches them, I think that's part of our communication plan. Second question, after Halloween, we saw that there was an increase in cases. Do you expect the same thing after Christmas, after the gatherings? Because we're wondering if the healthcare system will be even more overwhelmed after the holidays. Well, it's clear that the question is, if people do not respect the restrictions that we're putting in place, because it's clear that after gatherings, depending on the number of people, Christmas, or it's going to increase the transmission. The virus is present, but now balancing that with the risk that grandma can't see her grandchildren for last Christmas or whatever, we accept this risk. We want to manage it, and it's going to be conditional to how things go. If by Christmas or we've got a big increase in hospitalizations and our system is cracking, well, that's why we're asking people to deploy the efforts now. Every effort that every individual makes will allow us to see our family members, our grandparents. We have to think about them. We have to protect them. And I think that's why we want to keep ourselves at a level where we can allow ourselves a slight increase in cases, but without overwhelming the system everywhere. We'll go to the English questions.
Jesse Fight with the Gazette. Monsieur Legault, you mentioned that most indicators seem stable everywhere besides Saguenay-Lac-Saint-Jean. Does this mean that we could possibly see some measures loosened in other areas before the holidays, or do you expect them to be in place until then?
Okay, what I said is that indicators are stable. I didn't say that they are low. So they are still high, at least they are not increasing. We never know, but for the last few days it's not increasing, but it's still high. So that's why we think that we can afford the actual situation, but in order to afford the actual situation, we have to keep the actual measures.
Perfect. And a question for Dr. Arruda. Quebec's English School Board said holding elections during a pandemic is a mistake. Could you explain why you believe this is safe, and do you plan on expanding mail-in ballots for the election if it takes place?
In fact, elections could take place if they are following a very strict protocol, the fact is that we are not recommending, if it's not necessary, to have, I would say, this type of a situation. But if it's necessary, it can be done in a very strict protocol.
And what would those protocols be? Would you mind maybe explaining them?
It's all kinds of protocols that will make people in distanciation of 2 meters. They will wear masks. They will have good hand hygiene, control people coming in, control people getting out, not having, I would say, crowding people outside of the pool.
Thank you.
Kelly Gregg, CTV.
Good afternoon. You spoke for school holidays about extending the holidays into January, so after Christmas, and having that as a quarantine. Why not have that quarantine period before Christmas so that when Christmas comes, it's less of a potential spreading event?
It's an issue of practicality, we could have decided to confine everybody right now. The impact of stopping things is there, and I think that kids are going to be at school, let's say till 16th of December, and then we would have to take I would say weeks before. To lower the transmission. The virus is circulating everywhere. So I think it's for practical reasons, and I think it's easier to do afterward. But both could be looked at. But the issue here is to get the good equilibrium, because we don't want to confine everybody. It could be a solution. Let's say, let's everybody go back home and stay there for a month, and then we will go back to lower rates. But it's almost impossible. People will get crazy.
And bringing it to the present, people right now, in anticipation of Christmas, are going out to do their Christmas shopping. There was money in the budget to bring people back to downtowns. Montreal seems to have these new parking measures that it wants to increase parking downtown. So if you could talk a little bit about the risks of Christmas shopping and if that is something that you see transmission in.
We are looking at this, actually. I think it's a very important, show malls are places where people can be crowded and everything. Malls, I'm sorry. Very sorry. Malls are places where people can get in. So we are looking at some, I would say, some recommendations for those stores to apply, to respect distanciation, hand hygiene, mask wearing, and different other options that are looked at, because we've seen in spring a lot of measures done by some stores, and we've seen in the last months a certain relâchement so we must come back to a tight approach, because we don't want outbreaks. Even, imagine you are doing your shopping, you get the disease, and you cannot have a good time in Christmas time.
Just to clarify, so will there be new restrictions for stores about how Christmas shopping is done? Or is that kind of something that should be done?
I think to make sure that we are discussing, we are looking, we are in contacts with some malls operator, just to make sure that first they will follow the actual measures, because sometimes just the direction in the mall are not followed, where people bring themselves. So we have discussion with them right now, but I don't think we need additional measure. We just need we don't need new measures. We just need the actual measures to be followed.
Thank you.
On va y aller avec CBC.
Jay Dermal from CBC. I have a couple of non-COVID questions. First for Mr. Dubé. There's some ransomware threats to hospitals across the continent, including the Jewish General. It's being affected right now. The ransomware attack happened a while ago, but it's still being affected. I'm wondering if you're concerned about this and if you're speaking with the hospitals and what is being done.
Well, if you refer to the attack that was done weeks ago, is that what you're referring?
Yeah, they're still being affected by that one.
Yeah, they are. And I think the right measure that was done was to close, to turn off the computer, because at that time, at least the personal information is not being accessible. So, but the danger with that, or the negative side of that, it takes longer to reset. I haven't had communication with them probably for a week. We have this cyber attack group that is led in the Treasury Board. So, but I haven't heard for that for a week now. So is there any new development? I need to tell you, I don't know that.
Okay, Mr. Legault, this morning Chief Picard and Minister Lafrenière announced a consultation table on First Nations issues. Is this enough to adequately address the issues and realities First Nations communities are facing?
Okay, I've met Chief Picard this morning with Minister Lafrenière. We had a good conversation, a good meeting, and we discussed many points. If you remember, in October 2018, when I was named Premier, or choose Premier, I met with the chief of the different nations, First Nations in Wendake. And I told them that I would like to have a kind of agreement that we have with the Crees. I would like to have this kind of agreement with each of the different nations. For all kind of reasons, it wasn't possible to negotiate this kind of agreement. So I've asked Chief Picard to help me having these kind of negotiations. We think that with the political table, where we'll have Chief Picard and Yann Lafrenière, we'll be able to do a part of the work. But we know very well that we have to negotiate one by one with each nation. And Yann Lafrenière is working on that. And I hope also that we be able to answer to the 142 recommendations of the Vien report as soon as possible. So I would like, and I've asked Chief Picard to try to identify 2-3 priorities for each of the nations and then start giving results. I think it's about time we see results, that we see action, and it was a very good meeting with Chief Picard.
On va passer à Global News.
Good afternoon. My question is for the Premier. My first question. It sounds like Dr. Arruda is not approving of the school board elections. Why did you say that Public Health okayed it yesterday?
No.
No?
He's approving.
Misunderstood? Yeah.
I told that if there is strict situation, way of doing it, I can approve. If the protocol is follow up, I can approve. But I'm just telling, if it's not necessarily, if elections that you want to prepare are not necessary, it doesn't work perhaps to put all that process in place.
So it has the okay. It has the okay of public
It has the okay of public health, and I think it's important when you look at when was the last election that we finally have an election.
And the second question is, thousands of daily tests are done with people who have COVID symptoms or may have come into contact with someone who has the virus. Should testing be expanded to allow random testing of asymptomatic people? Would that tell us more about the transmission of this virus?
We are using, I would say, based on our scientific recommendations of different experts, the best use of the tests that we have actually. there's going to be a new addition of new rapid tests that are going to be used in specific situations. I think in the next months, or the combination of both of them are going to be helping us to better understand what is going on. But I can tell you, actually, this situation is followed up day by day, and our experts are always trying to use the test the best way it's going to be fitting, because if you use a test and too much people are symptomatic and there is a lot of cases, you're going to lose a lot of tests that could be better used in another way.
Thank you.
Merci tout le monde.
Merci tout le monde.
Merci beaucoup. Merci.